Do you think the risks for women are different, probably greater than the risks for men in sport? After all, we're asking them to play on pitches the same length, with balls the same weight, all the other pressures that are on them. And I'm not suggesting that they can't be equally skillful, but biologically they may be less strong or less able to cope with those
Yes. Well, as the father of 3 daughters, I'm incredibly pro women's sport, and also, as you said in your introduction, I've been involved with the world of ballet for 40 years, and I've come to have a most enormous respect for dance. I think some of the ballerinas are as tough as your front row international rugby forwards.
Yeah, I'd say it's amazingly athletic pursuit.
But I mean, it's a source of enormous pride how women's sport has come on. As you know, I've got a chapter in there about shrinking violets and looking at the history of women in sport. But they do come with different issues that need to be thought about. And in fact, we had a symposium at the university last week on women in sport. One particular area, well, 2 particular areas, are concussion in sport in women and anterior cruciate ligament injuries of the knee. We know, there's been very little research done, which is a source of shame, really, in rugby, etc. But it would appear that women are more susceptible to concussion, for instance, in rugby, per exposure, per playing hours, and generally they tend to take longer to recover. And there are issues around neck strength, which is very important in your ability to withstand impacts that need to be worked on.
But you'd expect the impacts would be lower because, again, the body weights are that much less than in male rugby generally.
Well, interesting. There's some very good research going on at Swansea University, and I've been working and talking to them. It seems that the mechanism of concussion may be slightly different, in that more women seem to concuss themselves in rugby from head impacts on the ground.
Okay.
Whereas in male rugby, it tends to be more the tackler is the most one at risk. So
the tackler?
Yes, the tackler, rather than the person being tackled, is more likely to injure themselves. So we've been looking at that. And the other area, as I said, is anterior cruciate ligament injuries. Sky asked me to do a TV piece before the World Cup, because we're just getting so many anterior cruciate ligament injuries in women's football.
Yeah.
And that's got a lot, some things you outlined, I hope that it will become a thing in the past, but often teenage girls are coming into football later than the boys have, so perhaps their techniques have not been so well honed, and that will change as more young girls come into the sport. Often they're put onto inferior pitches. The coaching may not be as good. Traditionally, women's football boots have been men's football boots, and those need changing. There are
Funny, I assumed when I asked the question that they would have changed, that they would be lighter weights.
They are changing, but they've been so far behind. Right. And then there's the societal views of how we treat young girls, that we think that they should be doing girl-based things. And I look back on my daughters and now my granddaughters, and encouraging them to do whatever sport they would like to do. And then, but we do have other issues with the female anatomy, very much to do with their pelvis, their Q angles, in the size of their intercondylar notches. And then the other thing which is coming through, and there's a lot of research being done, is the endocrine environment, and also the stages in the menstrual cycle. So all of those we're learning about. And American soccer learned this first, because American soccer grew on the female side much earlier than in England. And they were seeing 20 years ago this epidemic of ACL injuries, which we're now beginning to see now. So it's not something new, unfortunately.